As we come to this last day of the congressional session before the district work period begins in August, I thought that my constituents might be interested in some of my views and thoughts about the health care legislation that's presently pending before the Congress. In the early 90s, I went to a reception in Lebanon, Tennessee, where the doctor who delivered me came and brought my records, and I asked how much he charged back then, and he said he charged $60 for 9 months of care and the delivery if they could afford it. And doctors used to make house calls, and medical care used to be cheap and affordable by almost everyone. We took what was a very minor problem by bringing the federal government so heavily into medical care in the mid-60s. We started a process that has caused a very minor problem to become a major problem for almost everyone. Now, if we put the government even more into it than it already is, and come up with additional big government rules and regulations and red tape, what we'll end up doing is driving up the cost of medical care even further. We'll end up having waiting periods, delays. We'll end up with some form of rationing, although they won't call it that. And it will all be done at just exploding cost. In fact, the Congressional Budget Office put out as its first estimate of the cost $1.6 trillion over the first 10 years. Well, Medicare and Medicaid, their first prediction was that after 25 years it would cost somewhere between $9 to $12 billion. Instead, it was more than 10 times that much after 25 years, and now it's quadrupled even from that higher cost. Medicaid became so expensive and so bureaucratic that in 1994, the Washington Post ran a front page series for a few days, and they quoted Senator Rockefeller, one of the authors of the original Medicaid legislation, as saying, quote, "It's a horrible system, a vile system, and it ought to be abolished." Those words were spoken by one of the creators of the Medicaid system, and that same series in the Washington Post quoted a scholar from the Brookings Institution as saying that it is a success story of the American political system. We've created a program so terrible that we're forced to go to total reform. And now what some people are saying is we're attempting to create Medicaid for everyone. Actually, what we need to do, we need to go in the opposite direction and try to go more towards a free market medical system. We need to go more towards medical savings accounts and medical vouchers for those who can't afford medical savings accounts, so that we introduce more competition and more choice into our medical care that we have in this country today. We have the greatest medical care in the entire world, and if we're not careful, we'll mess that up, and our people will be far worse off in the long run. I hope that we don't do that. I'm very pleased that so much opposition has arisen to this bill in the first place, and I hope that that opposition will grow as we get further into this process, and I'm glad that we didn't allow the leadership of the Congress to rush through a bill that nobody understood before we left for this August district work period. And I'm always glad to hear from my constituents. They can call the Knoxville office by calling 523-3772. They also can call our Washington office by area code 202-225-5435. And certainly we're always open to correspondence as well. And our address is 2207 Rayburn, R-A-Y-B-U-R-N, House Office Building. You can just put Rayburn, H-O-B as in boy, and it's 2207. And the address is Washington, D.C., 20515-9404.